In this video, I am going to demonstrate the technique of CPR, that is cardiopulmonary resuscitation on an adult. We'll practice the complete sequence of CPR with rescue breaths and an AED, that is automated external defibrillator. Scene is safe? Hello, are you okay? Are you okay? Help! Help! Hey you! Activate an emergency response and get an AED. Assess for normal breathing and pulse. Check pulse. Locate trachea on the side close to you. Slide 2 fingers into the groove between the trachea and sternocleidomastoid muscles, where carotid pulse can be felt. Check for at least 5, but no more than 10 seconds. To minimize the delay in CPR, assess breathing at the same time you check pulse. Check victim's chest for rise and fall at the patient's side. Make sure patient is lying face up on firm flat surface. Remove or move the clothing covering the victim's chest. Position your one hand in the center of victim's chest over lower half of the sternum. Put the heel of other hand on the top of the first hand, extended or interlacing the fingers for support to arms. Strengthen your arms and position your shoulders directly over your hands. You can also grasp around wrist of first hand. Push hard, push fast. Compress at a rate of 100 to 120 per minute. Allow complete chest recoil after each compressions. Minimize interruptions in compressions less than 10 seconds. Give 30 compressions over 18 seconds. 29-30. For breath to be effective, the victim's airway must be open. Place one hand close to victim's head on victim's forehead. Push with your palm to tilt the head back. Place fingers of the other hand under the bony part of the lower jaw near the chin. Lift the jaw to bring the chin forward. Stand at the head end of the victim. Place one hand on each side of the victim's head. Place 4 fingers under the angle of the victim's lower jaw and lift the both hands, displacing the jaw forward. If lip closed, push lower lip with your thumb to open the lips. Deliver each breath over 1 second. Give 2 rescue breaths. Take a pause between breaths to allow for lung deflation. Observe the chest rise with each breath. Resume chest compressions in less than 10 seconds. 30 compressions as to 2 breaths.